The NCH Heart Institute is running a clinical trial right now on new ways to treat patients with atrial fibrillation. Atrial fibrillation, or A-Fib, is an irregular heart rhythm that can lead to blood clots in your heart. But before we get to that clinical trial, in today's Your Healthy Family, we're talking about other treatment options for this condition.
The good thing is once we diagnose A-Fib, we can treat them.
Dr. Dinesh Sharma specializes in heart rhythm disorders at the NCH Heart Institute. He says certain medications can bring the heart back into regular rhythm, but patients with atrial fibrillation are at high risk of stroke because when the heart isn't beating right, the blood flow is sluggish and can form tiny blood clots.
One of the important treatments is blood thinners, which can decrease the risk of stroke by around 70%.
But some patients have trouble taking blood thinners.
They start having problems such as bleeding, or they fall a lot, or they have some conditions which make them not suitable for blood thinners.
So another treatment option, catheter ablation.
We go through the groin into the heart, and we cauterize the tissue in the heart which think is unstable or causing the arrhythmia.
So using heat or cold to create scar tissue in the heart to block abnormal electrical signals and bring the heart back into normal rhythm. Dr. Sharma says this is 80% effective. But
it has its drawbacks because heat or cold is not specific just to the heart.
Meaning that extreme heat or cold could damage surrounding organs like your esophagus, which is right behind your heart. Dr. Sharma says the risk of this is less than 1%, but still there is always that risk. So NCH is running a clinical trial right now that could be safer and more effective in treating A-Fib. We'll tell you all about that in tomorrow's Your Healthy Family. I'm Lisa Greenberg, and you can find more health stories when you go to fox4now.com/yourhealthyfamily.